Good afternoon, everybody. My name is Dave Corin, Executive Director of the National Sports Media Association. We're talking back in the game today, what we need to do to get back on the field, on the courts, whatever other arenas we play on. Our guest panelists today, and we thank them very much for giving their time. Karen Weaver, Dr. Karen Weaver of Drexel University, and Murphy Grant of Wake Forest University, who is the Healthcare Administrator for the Athletic Department and a Senior Associate Athletic Director. Without further ado, and rather than me rattling off bio, I always find it more interesting to hear it from the horses' mouths themselves. Not to say anything that you are equine, but we will start with Dr. Weaver in Philadelphia. Karen, welcome. Talk a little bit about your background and how you got to where we are today.
Sure. Thanks for having me, and welcome everybody. My name is Dr. Karen Weaver. I am currently an associate clinical professor at Drexel University, but I wasn't always on the faculty side of the house. For over 30 years, I was in college athletics, both as a head coach and as an athletics administrator in NCAA Divisions I and III, as well as working at a community college. I coached field hockey, and I was fortunate to win a national championship in Division III and coach a Division I Big Ten school to a top 5 ranking in that 15-year career. I loved coaching, but I really felt I was destined to become an athletics administrator. So I shifted to that in 1998. And from 1998 to 2012, I was a Division I and Division III athletics administrator, as well as at a community college. So I got a very broad perspective on this particular issue, but really how challenging it is every day to get your athletes on the field safely and how to run an effective and ethical athletics program. I pursued my doctoral degree back in 2007 at the University of Pennsylvania. And when I was kicking around looking for a dissertation title, I was noticing that there was this brand new thing launching called the Big Ten Network. And I was quite fascinated because as a former field hockey coach, they were actually going to show field hockey on television. So they approached me about becoming a color commentator. And my first game, when they flew me out to Michigan State to call the Michigan State Northwestern game, I was absolutely floored at how many folks were there, that a 53-foot truck was there, that a satellite uplink was there. And my first question was, where did the money come from to do this? And so that became the basis of my dissertation. And I wrote and finished my dissertation in 2009 on the launch of the Big Ten Network. That has led me to a teaching career at Drexel, where I have taught undergraduate courses in digital media, digital sports storytelling, technology and sport. But then as I pursued my degree in higher education management, I also wanted to understand why there wasn't more of an intersection between college sports and higher education. The two seemed to run on parallel paths rather than intersecting paths. And I think this COVID-19 pandemic has given us an opportunity to try to look at these things together, because you don't have the campus and the athletics program independent, they are dependent upon each other. So that has informed my writing. I've been writing for Forbes.com since January. I also launched a podcast called Trustees and Presidents Managing Intercollegiate Athletics, because I wanted to understand how senior leaders in higher education at the trustee level, president's level, vice president's level, and a variety of other entities that support higher education, how their view of athletics was evolving over the year, and also, quite frankly, how critical college athletics is to the branding and marketing of an institution, but also in smaller schools, it can be a very strong enrollment driver for an institution. So all of those experiences lead me to my thinking today that I'll be happy to share with you.
Thank you very much. And Murphy, you're up.
Well, Dave, thanks again, and welcome to the panel. Thanks for the opportunity. I truly appreciate it. My name is Murphy Grant. I'm the Senior Associate Athletic Director at Wake Forest University. I actually just started here this past August, so I'm upcoming on a year. It's been a wonderful year here. My role at Wake Forest as Senior Associate AD and Healthcare Administrator is I oversee the healthcare providers, the departments that truly touch the student athletes. So the sports medicine department, the sports performance and strength conditioning coaches, sports psychology, and sports nutrition. I am a healthcare provider by trade, an athletic trainer, a former college student athlete, most recent Hall of Famer at Quincy University. Actually will be inducted in the Hall of Fame for athletics this fall, if there is one. Thank you. I've got my degree in athletic training there. Then I got my master's degree in exercise science, biomechanics, and kinesiology from Illinois State, and then became a certified athletic trainer. Have been in many different levels of sports. Worked for the Boston Red Sox for a year. Worked as head athletic trainer at an NAIA school. Was at Oklahoma State as the athletic trainer and strength and conditioning coach for our men's basketball program there with Coach Eddie Sutton. And then most recently was the director of sports medicine at the University of Kansas for the past 13 years. But even alongside of that, I also chair the Intercollegiate Council for Sports Medicine, which is at the National Athletic Trainers Association. So every single college and university in the country, from Division I down to the two-year institutions, there's oversight there with everything that goes on medically on their campuses. So with regards to COVID or heat-related illness or sudden cardiac death, there's a lot of involvement from myself personally, then my committees. Again, like I said, as a former student athlete, the health and safety of our current student athletes is the number one priority for me, and definitely for our student athletes here at Wake Forest. I think you muted, Dave.
There you go.
There you go.
Murphy, let me ask you. I'm guessing that you've been driven crazy by the number of scenarios that you have had to put forth to try to get all the student athletes back out there. Yes.
Yeah, absolutely. I was just having a conversation with some folks a little while ago. I just remember in March when we started hearing about COVID, and it was the ACC basketball tournament. We were right around spring break. We truly didn't know the depth of it. We were here, everyone was trying to do some extra cleaning protocols. We all had our nice flyers on washing our hands and covering our mouths. And then things began to get canceled, and once these sporting events started being canceled, classes were canceled, it really changed the landscape of what was truly going on. And then from there, the game plan was, how do we safely return to campus? How do we safely return to sport? And that task, it's a pretty intense task. I think before we truly know and knew what was going on with it, the goal was to, we can't have any positive COVID tests on our campuses because that would shut down everything. And then people just started to understand that the world could not prevent it. So the goal was to, as you're putting together these plans, is to minimize the risk of spread and have a really, really solid plan in place that if you did have anyone that tests positive, that you could take care of them and all those individuals in contact.
Karen, you wrote, when I first became aware of you and COVID, you wrote the Forbes article, I think it was the first week of May, and you questioned how a football program could get back on the field with the sheer number, I guess you'd say, combinations and permutations of people involved and contact points. Right?
Yeah, absolutely. I was just struck one day by thinking about all my collective experiences around practice facilities and athletic training rooms and indoor fields and outdoor fields and equipment storage closets and all those kinds of things. And it just really occurred to me that this could be really almost insurmountable because of all the contact points. the week before I wrote that, I'd had a guest on my podcast who was a University of Pennsylvania infectious disease doctor. And I said to him, I said, where are the issues that you see them? One of the things that he brought up, which I hadn't even considered, was the issues of fomites. And fomites are any surfaces that live at a practice. If you think about football, the ball is a fomite, the shoulder pads are fomites, the blocking sleds are fomites. And he's like, think about the number of times that in a single practice, people will touch those fomites. How do you keep people from doing that? And then he said something to me that really struck me. He said, remember when you bring teams back, and he's using Philadelphia as an example, you're bringing them back into a community that could already be very well stretched out in terms of healthcare because of ICU beds being full, because of our limited capabilities for testing, because at that time we didn't have as many possibilities for testing as we have right now. And he said, and I could see it in his face. He was exhausted. He'd been on speed for 2 months, just trying to manage all of the cases that his one hospital was dealing with. And you multiply that by the impact of bringing a team like the size of a football team back into a community that's already has their healthcare resources stretched thin. And you start to think about, what's my role in this community? And do we have an obligation to take the outside community into account while we're bringing and introducing all of these new people? And you can then extrapolate that by the campus population of students and faculty and staff. So it really got me thinking, and that's what, ultimately led me to write the article.
Murphy, you're, I guess, partially responsible for making sure that all of those contact points are disinfected. Football team has started to come back on campus. What is that process like?
We decided on a phased approach to it. Again, just like many colleagues around the country, wanted to make sure that it was safe, and understanding that, just like Karen said, that our communities, our other healthcare providers around Winston-Salem and around the country know that how taxed there are. And they are. So as we have brought back and phasing in our student athletes, we have gone through, 7 days of quarantine at home, 48 hours self-isolation here, additional 5 days of quarantine before doing a COVID test on them. Again, understanding that there isn't a vaccine for it yet, and the treatment of COVID currently is that 14 days, the 10 days recommended by the CDC, 3 days fever-free, so we're trying to treat them prior to even testing them, again, just knowing that coming in and, early on when we were putting together our plan, it was, 48 hours before seeing any new symptoms, depending on what city that you come to. So trying to take all of those precautions on the front end before they arrive on campus. Again, we're able to control a few more things being on the college campus versus when they're in their apartments and when they're home. So, those are some approaches that we took. Sport has not been canceled, so everyone's still trying to prepare for sport. And we can get into some other things once we talk about preparing for sport.
Karen, you had another article on Forbes today. I think the one word or the phrase that hit me the most was, it's hard.
Yeah, it is, because the CDC, like all of us, keeps changing their guidelines, right? For what they want now as of July 1st to happen on college campuses. So I'm going to take a look at the article and just give you a couple of my headlines. So the big news was the CDC no longer recommends entry testing for all returning students, faculty, and staff. So I've read of some campuses who've said, we've got to test everybody, faculty, staff, students, part-time people, full-time people. The CDC is saying, don't do that now. And they're saying that for this reason: testing of all students, faculty, and staff for COVID-19 before allowing campus entry has not been systematically studied. It is unknown if entry testing in colleges provides any additional reduction in person-to-person transmission of the virus beyond what would be expected with implementation of other infection preventive measures like social distancing, face masks, hand washing, and hands cleaning. So that almost turns the whole idea of bringing people back on its head from the get-go, because the assumption has been we're going to test them all and we'll know where they stand. And what they're saying is that's not a good use of your resources. So that's a new piece. What they are emphasizing more of, though, is this emphasis on contact tracing. And I have not read a lot about how athletic departments are going to do this, because inherently apartments and off-campus living, it's very hard to just come into contact with your pod. I hear a lot of teams talking about creating pods of students. I don't know how you avoid coming into contact. And if for some reason you do start having symptoms, how do you go back and remember every person that you've been in contact with over the last few days? You know, you might remember your friends and your family and your roommates, but how about that person you shared an elevator with, or that person who was in a communal bathroom with you? You've been in contact with them as well. So the emphasis and the personnel needed to really do a robust contact tracing program is something the CDC is really encouraging. And I'm not sure, I don't know if athletic departments have really addressed that.
And also in the article, you say who should be the case investigator who's responsible for that.
Exactly.
And you said in college athletic departments that the answer may be that it falls on Murphy's people, the athletic trainers, just what they want, right, Murph?
Yeah, right. Just more activity and more workforce. But again, that's a part of it, you know. But you know, with the contact tracing, that is probably the most challenging part is that and the management. You know, Johns Hopkins has a great contact tracing course in which you take. It's probably about 6 hours long, 5:45 to be certified as a contact tracer. We have several different individuals within the department here that are becoming contact tracers other than the athletic trainers, because it takes us all to be able to manage those individuals, which again, just understanding that, you know, truly you are infectious, you know, 2 days prior to even exhibiting symptoms. So remembering and understanding those folks that you have come in contact with is a challenge for many. You know, who was I standing next to? But again, those guidelines of, you know, 6 feet for 15 minutes, high exposure contact versus low exposure contact are things that you, as the healthcare providers and going through the contact tracing, that we have to truly be aware of. And you have to have those candid conversations with them. You know, I mean, we understand the severity of it and what it's done around the world and definitely in the States right now, that these are very, very real conversations. It is a very, very real respiratory virus. So there has to be a lot of candid conversations with our student athletes and our staff, for that matter, when it comes to the tracing piece.
And building on what Murphy just said, one of the trends that I'm keeping an eye on is, and this was noted over the weekend in a party outside of New York City in a place called Rockland County. Over 100 people attended an outdoor party, and a good percentage of them now have COVID-19. But they are having a lot of difficulty contact tracing those people because people don't want to admit they were there. So the idea of how do you create either a carrot or a stick for identifying people who possibly may just need to know that they've been exposed, and that could be another problem as well.
The amount of information that A is coming in and then B is changing as fast as it comes in, Murphy, I mean, it must feel like your head's going to explode sometimes. And you're also on the ACC's COVID-19 Task Force or Advisory Council. Where do you take all your cues from?
From several individuals. You know, in the ACC, we have some really, really intelligent individuals on that advisory medical group. You know, far more intelligent than I am. You know, but they're really good professionals, infectious disease specialists, the team physicians, our team physician, Wake Forest Baptist, there's a lot of individuals who are spending a lot of time that are, their responsibility is to care for the community, so they're seeing it, they're understanding it, they're getting a lot of information. And that's the beautiful part about all of this is information is being shared amongst us all. I think that we all have the same common goal in making sure that our student athletes are healthy and they're safe, but at the same time to provide something quality to them. So we're getting a lot of information from a lot of individuals, and so we're taking cues from all the physicians, and they're all saying the same thing. So that's a positive thing.
I was going to say there had been a lot of, I don't know if it's conflicting information, but it's good when they're all saying the same thing instead of
Correct.
Not knowing what's right, what's wrong in that respect. Karen, what should athletic departments be doing? You tackled a little bit of that in today's article.
Yeah, well, I think the one thing that I really assumed that athletic departments were doing, but it doesn't appear to be consistently applied, is having conversations about testing procedures and then what happens if you are or if you are not positive, not only with the athlete, but with the families as well, because I think the families have a right to understand not only everything that the athletic department is doing, but also the risks that their son or their daughter is assuming. And I think those are hard conversations to have. And I'm not sure the right person to have that conversation is the coach or a member of the coaching staff, but it might be somebody like Murphy or somebody else who's designated to have those kinds of educational opportunities where families can ask questions without fear of being judged or losing their spot on the team or, feeling disloyal for asking any questions about this. Because as you both have emphasized, this is serious. And while athletes themselves are not in the high risk category, they can be very good spreaders. They can do a very good job of getting the virus to somebody who is more susceptible, and that could be a member of their family. So that's one thing. And the other thing that really surprised me was the failure rate of COVID testing. And sometimes it's in the 20 to 30% rate that you might get a false positive with your test. So what's the strategy around making sure that you have the right answer when you test to be sure that the athletes aren't unduly influenced one way or the other? So those are a couple things that I've thought about.
Murphy, you want to jump on that?
Yeah, a couple of things. With regards to the sharing information and informing student athletes and their parents, again, I can speak for what we do here at Wake Forest. Myself and our team physician, we're on every team call prior to their arrival back to campus. And we flat out tell our student athletes that right now during this period of time before classes begin is totally voluntary. If you do not feel comfortable coming back to campus, you do not have to come back to campus. But if you choose to, these are policies and procedures that we have in place. And it's myself and our team physician who's having that conversation with the parents, with the student athlete. And it is a very candid conversation. Again, we understand the 18 to 22. We understand that, like Karen said, they could be the spreaders. So, one individual could truly shut down an entire team depending on that team. So they have to understand what their responsibility is also as a representative of the team, as a representative of their families and the institution, that they need to be thinking about that as well. Some other things that we are truly looking at is, granted they are in a low risk, the 18 to 22, assumably very healthy, athletes, but, how does this affect the return to activity, if someone does become positive? And I think a lot of leagues, NFL, soccer, all these sports that are returning, they're looking at that as well, as how it's affecting their athletes returning back to a high level of sport. So there's a lot of communication from myself to some of these leagues about how they're addressing that with their athletes currently.
I mean, typically, as you said, the 18 to 22 demographic, players want to play, coaches want to coach and coach their players. How important is it to have that open, honest line of communication with the coaching staff?
Well, it's extremely important because it truly affects the coach. I mean, I know Coach Clawson here has had his conversation that was in media at ESPN, but you got to think if it's the cornerbacks coach, the DB coach, and they are meeting in with their players, and one of the players becomes COVID positive, that means that coach is also going to have to quarantine. So it affects many individuals. So you have a coaching staff that could be without coaches. And that's how quickly it affects everyone. So it'll very quickly become real to the coaches as well. So there has to be an open line of communication on how they're feeling every single day, but understanding that actions of one could affect many.
Karen, it looked like you wanted to add to that, maybe?
I really agree with what Murphy said. I think for a long time now, coaches, and I can say this because I was one, you get in this mindset of, all we got to do is pull together and we can overcome this. And this is just not one of those situations where you can just physically or mentally overcome this. You have to reorient your thinking. And I can recall, I read somewhere earlier this spring that the athletic director had sat down with some of the coaches and said, don't forget, you can get this virus too. And if you're positive, I'm not going to let you anywhere near your team or the facility until you're cleared. And that seemed to be news to some coaches. They thought they could just be out there doing what they do. That is the strength and the weakness of coaches sometimes. So understanding where the limits are for them is also extremely important. And also understanding that, they're going home at night. And so what are they bringing into their homes at the end of every practice? I mean, when you talk to doctors and nurses, they will tell you that when they're done a shift, they come home, they take all of their clothes off, they put them in the washer, they take a full shower, they don't let their family anywhere near them until they've had a chance to do this. So we haven't talked about those kinds of practices, but, I don't know of too many families right now who don't have someone in their family who have some sort of comorbidity that might put them on edge on this.
Murphy kind of alluded to it, but Dave Clawson, the head football coach at Wake Forest, came out and said he will self-isolate from his wife, who had chemotherapy for breast cancer a year or so ago, and that's when it's really serious, I think, right?
Yeah, that's true. Again, it's not real to some until it becomes real for them, and I think that's what we've been dealing with, in my opinion, around the country. Until it truly affects you, that's when you understand the seriousness of the virus.
Have you had to get into signage and for those who don't know, Wake Forest just built this huge athletic training facility for football, basketball, nutrition, etc. I'm guessing there had to be some signage developed for traffic flow, for don't touch this, don't touch that, correct?
Yeah, absolutely. We've, our facilities department and, Ellie Shannon and pretty much everyone in our administration, we speak constantly, every day, multiple times a day, just on this topic, and signage. We have one entrance in, one exit out. It may be an inconvenience to walk all the way around the building, but at the same time, we're trying to protect everyone. It's controlling the controllables, because we understand that, there's going to be a point in time we can't control this. Once individuals on our own, like you said, once we come, we leave work every day. There are some things that we just can't control. So we've done that. We've closed down our nutrition center currently. We have one entrance in, one exit out, and this is for everyone. We don't want anyone kind of crossing paths. We're limiting the touches on the doors, so we've been looking at everything from field access, how do they walk out to get on the outdoor fields, We don't let them come back into the indoor. But it took a team of us to be able to think about all those things. And I've been very lucky to have many other individuals who have the same concern because they want to protect our student athletes to help prepare for this.
And Karen, one thing probably a lot of people don't realize that even these players who are seemingly healthy and strong, 18 to 22, the numbers of them who may have some kind of underlying medical condition, probably a lot more than most of us would think.
Born with type 1 diabetes, you can have a heart defect and not know it. You can have other things that you just haven't shown up in your regular physical exams yet, that if you contract COVID-19 can absolutely accelerate the worsening of the illness for you. So when you put them in a condensed environment like this and ask them to perform at their maximum capabilities, you just don't know what might come out of that if someone then becomes COVID-19 positive. So, and I just didn't even mention that there's a strong preponderance of this virus attacking people of color, and all of the comorbidities that families of color have demonstrated in this. There seems to be a preponderance in that direction. It doesn't mean that white folks aren't able to have it. They do, but people of color seem to have more issues in their families, and that we just don't know enough as to why that is just yet. We have theories, but we don't know why.
I was struck, I think last week they had a breakdown in the local newspaper here in Winston-Salem, the Winston-Salem Journal, and the percentage in the Latino community was the highest of any of the groups here. And interesting sociological, I don't know if experiment is the right word, sociological inquiry could be done, or investigation. Love to open it up to questions from our members who are on now. David Teal, I know you had a question or three. Go ahead and unmute and ask away.
Yes, thanks to you both. My name is David Teal, and I work at the Times-Dispatch newspaper in Richmond. I'll start with Murphy. Murphy, Dave referenced the ACC COVID-19 advisory panel on which you sit. I believe that group was formed about 6 to 8 weeks ago. Where are you folks in terms of, are you trying to formulate a conference-wide testing protocol for during the season? Is that the goal? And if so, where might you be in that process?
Yeah, that is definitely one of the goals. And we actually have a call here at 5 o'clock, so I'm going to probably be getting off shortly. Yeah, that is one of the goals. We are looking at really what we want from a minimum standard for all ACC schools with regards to testing. We have put together some drafts. We've shared it back with the conference office. I know it will be shared also with the presidents and chancellors within the league. We'll wait to hear what the feedback is from what we've drafted thus far. Again, the goal is to make sure that we're protecting one another. We're looking at what we can do as a conference, but then also looking at what we perceive as a conference from playing non-conference folks as well. You know, I mean, there could be some institutions or leagues that may not have the ability to test, you know, so we have to consider that as well. Are our institutions comfortable with playing against opponents that do or do not have the capability to test as well, to keep our student athletes and our coaches and staff safe as well? So there's a lot to consider, you know, as we put this together. And again, you have 15 schools that are inputting their opinion and their thoughts and representing their institutions. So we have to come to a consensus with it.
What have you found to be the costs of testing? And does that at some point become an issue?
You know, it could. You know, what we found that there is a little bit of a range depending on what part of the country you're in. Again, knowing that, are we talking about asymptomatic testing or symptomatic testing when it comes to what we're doing within the league. And those are some strong and the candid conversations that we're having on the ability of all the institutions to be able to do that. But if it's a standard that the ACC puts out, then everyone needs to uphold the standard.
What are the cost differences there? Can you share with us amount?
I mean, there's some folks that they're going anywhere between $80 to $100 per test, but who knows? And where it is at Notre Dame and versus Miami, and I mean, we have ACC just is a huge demographic, and just all the states, so there's many different, you got from Atlanta to Winston-Salem to Raleigh-Durham to Syracuse, New York. I mean, there's just a huge range of states and cities that are trying to cover and which the ACC covers. So that price and cost varies from city to city.
Thank you, sir.
Thanks, David. Thank you, Murphy. Karen, question for you. There's obviously the economic tug of war here, where if college football is not played, it will be very detrimental to college athletic programs and schools as a whole. That's a tough tightrope to walk, isn't it?
It is. There's no doubt about that. The economic situation of how college athletics has funded itself is under tremendous stress. I think I read somewhere that somebody said it's about a $4 billion a year industry. And most of the athletic department's revenues come from your football program, if you have a football program. That being said, this coronavirus will not adhere to or abide by or follow our academic calendars. It has no inclination, no need to do that. So for us to try to constantly fit our plans into a coronavirus schedule is not a good idea. So rather than trying to do that, are there other ways that we can look at this? One of the ways that has been revisited in the last few days has been the idea of pushing the fall seasons back to maybe the early spring. Now, I'm not a fan of having football and other sports play a spring schedule and then play a fall schedule. But maybe we need to really think about what this means, because we're trying to match a typical practice and competition schedule. And I just think this virus isn't going to have it.
I think we're going to have to think out of the box a little bit.
Yeah,
is what's going to happen. So Murphy, where do we fit in? Where does the media, or where do the media fit in here? We're talking about, and not that it's under your purview, but in many instances, press boxes are shoulder to shoulder. I'm a sideline reporter. I'm guessing if there is a football season, I'm not going to be on the sidelines this year, even if I'm allowed. How is that all going to work?
Yeah, we are, again, speaking about that on our medical advisory group as well. It'll take more individuals outside of, we'll bring the medical perspective to it, but it's going to take a lot of individuals with regards to facilities and being able to open up facilities, having communication with the officials, and where we put the officials and how we put the officials on the fields, opening up the sidelines. Do we, instead of going from the 20 to 20, do we go down to the 10 so we can socially distance on the sidelines? There's a lot of things to be thought about, and we're having those conversations. I guess that's the positive piece to it. I know that on the A5 calls, they're having those same conversations as well. What we want is everyone to, again, we want to keep our student athletes safe. That is the number one priority for all the institutions, all the leagues. But then how do we safely do that? How do we keep our staff members and coaches and everyone that's associated with our institution safe? If we welcome you to, our ballparks or our stadiums, we want you safe. We don't want you leaving, and then you contract COVID-19. So we have to look at that, and we're doing it. So it's a big conversation. So a lot of people are involved in it, but the conversations are certainly being had.
A lot of these programs are going to have to hire extra get-back coaches if you're going to go 10 to 10, right? And pay them more probably as well.
And stay 6 feet away.
Richard Broad, you have a question?
I do, and Karen, you stole the spotlight from me just a few minutes ago. I would like both yours and Murphy and anybody else who cares to participate on a thought that I have. My feeling is that I don't know how we're going to put together any kind of coherent or effective schedule for college sports this fall. I really don't. I don't see it happening. We sort of hastened our way back from the pandemic, and now we have increasing numbers, and some states are starting to close down. I think when you do something, you want to get it right. And as a coach, I always told an injured player, I'd much rather have you not play the next game or the next 2 games and play the 8 after that than play 2 games and miss 8. I want you playing 8 games rather than 2. I want something substantive than something that has to be interrupted, and then we're back worse than we were at square one, which we arguably may be at this time. But my proposal is this, that you find a date, and again, the coronavirus doesn't have its own dates. It's going to go as it goes. But we look toward the end of the year, the 1st of January, as our startup point. And we really focus on getting a grip on how we're going to do things right. And then we start, and let's not kid ourselves, there are 2 sports that really drive that supply the fuel for the engine in almost all athletic departments, basketball and football. We start the basketball season sometime around the 1st of the year, depending on your school's calendar, your school's circumstances, whatever the conference might be. And you start it, and you start playing games maybe 2/3 of the way through January. You play up there. March Madness is the first 2 or 3 weeks of March rather than the last 2 or 3 weeks. So what would happen is you'd end up playing 20 games rather than 30. Not what we want, but 20 basketball games is a lot more than 10 or 0. And football would start in training in March. Maybe the season starts in April, and you play 8 games instead of 12. 8 games is not going to make Jim Harbaugh or anybody else in that seat completely happy, but a lot better than playing 3 or again 0. I don't see how that proposal is going to take place for a simple reason. We're a very impatient people, we Americans. We want it done yesterday.
We're not impatient.
That's the problem. But we need to compromise. I know that's a word that is also not known in this country, or at least it was banned from our vocabulary about 10 or 15 or maybe 4 years ago. But we need to do that. And if you have sports in the fall that are viable in the spring, it's your athletic department's decision whether they're going to tag along with football. But it's an interesting situation. We make a compromise here so we can get back maybe to what we had in the fall of 2021, where we go back to the schedules that we have had. I'd be interested in anybody's reaction. Maybe people think I've been sequestered too long. Maybe there's some legs to this. Karen, you alluded to it. Anybody else? I'm listening.
I appreciate your tongue-in-cheek analysis of our ability to be patient, but that's exactly what this virus is requiring of us, is that we do look out for other people ahead of ourselves. And that's what I think is driving this discussion, is that we're so tired of being indoors and seeing only our families and doing these boring things that we need something to distract us. And the best thing to distract us is sports. So dang it, why don't the sports get started? And I think that's why people are feeling this level of anxiety. And you take that stress with the stress that's vocalized at teams and leagues and sports organizations to do something, we'll watch, and they know there's an economic opportunity there to be able to capitalize on that. But we can't lose sight of what Murphy said earlier, is that these are student athletes who we have taken, in college terms, in loco parentis. They are under our care because the parents have handed them off to us. And so for us to look at them only as an economic opportunity is failing in the mission of higher education.
It sure is. And a question I also have is, if we've got students at whatever school it might be, but they're just get virtually learning, and we've got a football team playing a full schedule, is not the tail wagging the dog in this particular case? And you're going to lead. That's the next step from that, is for football to break off, and maybe you have Stanford or Notre Dame or Michigan State's football program over there. They don't have to attend the same campus. And it's a question of where you want the student athletes to be and how do they fit into the educational experience.
Thank you, Richard.
Go again.
Appreciate that. We have a couple other questions. Christian Navy, if you want to unmute and ask yours.
Yeah, mine's for Murphy, just real quick. I know you have to go. For the student athletes who are back on your campus already, what has their reception been to the changes that you've made? And from what you have seen, how are they more or less following those guidelines?
You know, they actually have welcomed them. I believe there was, you know, like Karen said, maybe some anxiety to come back, but we've had those candid conversations with them and just told them the reality of it and told them you don't have to come back if you don't want to. You know, our plan was a phased approach, and we did that purposely. You know, we did not want the huge rush of 100+ athletes, because we understood that managing that many at one time was not an easy thing to do. And I don't believe that's easy on any campus. But being able to phase them back, being able to control a small group, you know, and get them used to entering one door, exiting one door, and just building that routine with them, because this could be the potential new normal with them, you know. So they have slowly bought in. You know, you still have those that are just like, why do I have to do this? Why do I have to wear a mask? I mean, we make them wear masks while they're training. I mean, that's our rule. And if you don't, then you're unable to train. You know, they have to get used to the temp checks every time they come into the building. I mean, we do not allow any student athletes into our buildings anywhere indoor unless they have a confirmed negative COVID test. So we're keeping them even outside and socially distanced. So just something new that they are having to get used to, but they're buying in and slowly moving forward.
Thank you. David Teal, you have another question?
Yes, this is for both Dr. Weaver and Murphy. We've seen some schools be very guarded and not release their testing results, but yet every Friday in my inbox I get an update from Clemson on very specific, the weekly totals, the running totals. I'm curious as to your views as to whether schools should be public with their test results.
Murphy, I'll let you go because I know
Yeah,
you're the one who's
you know,
got
I'll speak to it.
Yeah.
You know, I'm not sure that even understanding or anyone knowing what the positive or negative rate is and what that does for that institution. You know, this is a public health crisis. So anyone who tests positive anywhere in the country, that information has to be shared with your community health and your public health department. So that information does get shared with someone, it just may not be shared with the media. So again, if you think of protocol, whether you're at, you know, at the University of Washington Medical Center versus the University of Washington, whomever has a positive COVID test, that information is going to be shared with the public health department because they are the ones that are truly keeping track. So with some institutions that are, you know, have that open door that they want to share that information, you know, maybe there's a reason why. For some institutions, maybe they just feel that to protect their student athletes, you know, HIPAA and FERPA, that their true duty is to share that information with the public health department because it's the law. With something like this, there's a difference, so I don't fault any institutions who won't share that information, but I also don't fault those individuals who want to make sure that they understand that they're taking care of their kids, but they're having a couple positives, so I think it's an institution thing, institution decision, but that information is getting shared with someone, and that is the public health departments that are in each one of our cities and each one of our states.
What is Wake Forest policy going to be?
Well, we're currently not sharing them. I mean, obviously, we have to share them with our public health department because they need to know that if there's, I think if you have 3 on your campus, it's a cluster. If you have 5, it's considered an outbreak. They need to know that, so they are aware of how to treat it and how to look at your organization or institution. So all of that stuff has to be reported daily to really the government, pretty much.
Karen, any thoughts?
Just a quick one. I think this FERPA, the Family Educational Right to Privacy Act, has been widely interpreted to mean many different things on many different campuses. It can be different on a public campus than a private campus. And so I think that's where all this is falling into the middle of that, is that we just don't know what we should be sharing. There are still some people who believe that this is a HIPAA issue, but it's not a HIPAA issue because HIPAA involves only the sharing of medical information between medical providers and the person who's sick. So there's a lot of confusion in this area, and I think some schools are just erring on the side of caution.
Murphy, I know you have to go. Before I let you go, wait, no, you can't just go yet. Will we be playing football the first Saturday of September? Best
Who
guess.
will be? Will anyone be playing? Is that the question?
Yes.
I think I get asked that question every single day, and I truly don't know how to answer that question. I will say this, that sport has not been canceled. It has not. No one has said that there will not be sport in the fall. So for us at Wake Forest and every institution around the country, what we're doing is we're preparing our student athletes for that. Because one of the scarier things that I look at is, even when we have student athletes on our campuses all year round, there's still kids that are dying from sudden cardiac death, exertional heat illness, exertional sickling. That's another real thing. And knowing that our student athletes haven't truly been on our campuses or had any formal physical structured training, it is important that what we're doing is we're preparing them physically to be able to play sport. I mean, the worst thing you can do is, hurry up to do this and not prepare them physically. And then you run into these issues. We want to make sure that, from a cardiovascular standpoint, the cardiac screens, all the blood work to see who is a sickle cell trait and who isn't, all those things need to continue to be looked at. Some of the things that Karen mentioned from a comorbidity standpoint, we want to be able to look at those things, the underlying issues, if we're going to move this thing forward. So we're going to just try to prepare them and get their bodies physically ready, try to get their minds mentally ready and prepared to be able to play. If they say no, then at least they were prepared to play. Again, the worst thing is to be able to do this and they're not prepared. That can lead to some other issues.
Can't thank you enough for your time today. We'll let you get on to your next call.
Yeah, for sure.
Hope to see you soon in person.
Yeah, well, I'm in the office every day. So you guys take care. Thank you again for the opportunity.
Thank you. Take care. Anybody else have any questions for Karen before we go? Karen, what's next step? I'm going to guess you're going to say, ain't no way we're playing college football this fall. Just a guess.
I agree with Murphy. I get asked that question so many times. I wish I had a crystal ball. I mean, this virus is, when I wrote the article about a vaccine in May, the virus hadn't hit the Midwest yet. And California thought they had gone past it and survived it, and now they were in open up mode. So this virus is going to prove one thing, that's very unpredictable. And I admire schools like Wake Forest that are trying to get their athletes ready to compete, because I will tell you, I watched a National Women's Soccer League match over the weekend, And those athletes, I don't know how much time they had together. I don't think it was a lot, but I don't think they were ready yet to play a full competitive game. And that's the thing you're trying to guard against in this situation, is that you don't want to do all this work and then have them get injured on the first play because they weren't conditioned correctly. But we still haven't introduced the entire team. We still haven't introduced multiple teams, and we still haven't introduced an entire campus population into the mix. And those are all big ifs.
Yeah, the infectious disease specialist here at Wake Forest Baptist Medical Center, who's been kind of the guy at the media forefront, Dr. Christopher Old, today said he thought by 4th of July next year, we will see the light at the end of the tunnel.
Yeah.
So patience, patience, patience.
I will say this, I don't know if this hit any of your radar, but the University of Southern California, so the other USC, announced today that they are changing course and they're going online in the fall. So that could have some real implications for a lot of schools.
Yeah, there's a lot of consternation and still unknowns. I think Wake Forest just released this week, basically going to be doing some blended, some online, some face-to-face is the hope. I'm scheduled to teach a class in the fall. I requested to do face-to-face because it's a sportscasting class, and that's what I feel needs to happen. But I also said that I'm certainly willing, if it goes the other way, I'm flexible and certainly understand that. So interesting times in which we live. Anybody else with a question?
Dave, quick thing. Just want to say without monopolizing this question period, we have role models for college sports, all of which will be playing in the late summer and the fall, or intend to play. So as college administrators, as people who cover college sports, or even the high school level, we can look and see what Major League Baseball does, what the NFL does, what the NHL, NBA, and Major League Soccer do. And these can be our test cases, so we don't go in and make the same mistakes. But jumping in too fast ahead of them, we haven't even seen how those seasons would run. They can be great examples, and then the schools can go forward in a much more logical fashion with facts and empirical data at their fingertips.
Should have put you on the panel, Richard. Thank you. That's
all right.
Well said.
I'm available to pinch hitter, Dave, anytime.
Well, Dr. Karen Weaver, thank you so much for your time today and your insight. Find your thoughts fascinating on this topic. I think there are lots of fascinating ideas out there, but hopefully common sense will prevail. And for everyone else, thanks for joining us again. We will next week at this time be doing a story. This should get everybody's attention: coaches and media relationships. So we've already lined up Matt Brown, the head football coach at North Carolina, and have a couple other lines in the water. So we'll just stay tuned to nationalsportsmedia.org, and we'll be sending out those messages. Karen, thank you again very much.
Thank you.
Let's stay in touch.